on there some short rip images. If they're a
Thank you so much, Kelsey, for the lovely introduction, and to you and your team for inviting me to the conference. Water and environment have been near and dear to my heart since I was little. It's part of the reason I went into engineering. Another thing that's near and dear to my heart is my hand right now, which is due to a bike accident recently. So I'm operating on less than optimal here, but I'm very delighted to be here with you today. I went into engineering because I wanted to solve real world problems, and water, I kept on coming back to water as critical for human health, environmental health. How do you have healthy communities? I was really interested in that humans are technologies and how we create healthy communities, which led me eventually to be working with CAWST and now leading the organization. The theme of this year's conference of resiliency in every drop, is at the center of what CAWST does. In building human capacity for people to be able to take care of their own water sanitation or health in their homes, communities, schools, health facilities. I'll be going into this presentation by giving a little snapshot on CAWST and how we work, and then defining the problem of water sanitation and hygiene from a cost perspective, from an engineering perspective, and then going into the solution and wrap up, as Kelsey said, with a conversation. And that's what I'm most excited about, is to hear your questions and have a conversation with you. Just 2 seconds, because there we go. I want to first introduce you to Gladys. This is the woman that's at the center at the back of this photo with her 3 kids and her mom. She's a single mom, and when we first met her, she was selling fish and meal in little bags outside her home to go to living. She went on to take some training from a local organization that we trained, and the training was in water and health and the connection between water and health. And she became impassioned by this particular issue and started talking to her neighbors, and then volunteering to do more and taking additional training from this organization, and increasingly building up her acumen in water sanitation and hygiene for health and transforming her community. That led her to become a community health promoter within the organization itself. And so she was earning a living with this organization and created a network of hundreds of health workers, volunteer health workers in water, sanitation, hygiene for health. This is an example of thousands of people around the world who are making change within their community, and what we call is the multiplier effect of knowledge and capacity development for people to be able to take action. Now, not only is she changing her community, but the children that are being raised in these community don't know a world without better water and sanitation. So they're growing up in a place where they have the opportunity to succeed because those basic water and sanitation needs have been met. The other sort of side note about this is that's really powerful is the community that Gladys and her family live and play and work. Originally, their name was Chapuluso, which means cursed. As a result of the work of her and so many people within her community, they petitioned the government and they changed the name legally to Mapalo, which means blessed. When CAWST looks at the multiplier effect, it's not a one-way directional, but it's both ways. It's more than that. It's walking hand in hand, Gladys walking hand in hand with her neighbors, the other health workers that she's working with, and building up their skills and knowledge to be able to change and transform their communities. And likewise, CAWST walks hand in hand with organizations around the world to support people like Gladys and her family. What this looks like as our organization is we provide technical training, consulting support, and act as a center of expertise. We're behind the scenes supporting other organizations to be able to serve their communities. There's hundreds of thousands of organizations that have the mandate to provide water and sanitation to their communities and don't have access to the professional training and support. And we bring that and support them to continually improve and advance in their communities. One of the things that makes us unique is the sole focus around capacity development in WASH, very focused. Our niche is in non-networked systems or non-piped that people can implement in their homes, schools, or clinics. You can see over in this photo on the left-hand side is an example of one technology which we train on, which was designed here in Canada and actually kicked CAWST off. It's a biosand filter. It continues to be the most robust water treatment for a small scale that you can find in the world. Another thing that makes us unique is our hybrid business model. We're both a licensed professional engineering consultancy and a registered Canadian charity that enables us, the registered Canadian charity enables us to be able to serve those that would not be able to pay for our services. We have a team of over 50 engineers, educators, and researchers and other professionals that are solely focused on cracking this, on solving this enormous challenge of getting universal access to water, sanitation, and hygiene, or WASH is what some of you or all of you are familiar with. I'm going to be using that going forward as WASH. Another look at CAWST is our results. This is from 2021 alone. One organization, CAWST, based here in Calgary, Canada, established here. We produce education materials, workshops, online courses. That's exploded, obviously, over the last couple of years. Webinars, consulting support. We provide those both in person and online, and we train other organizations to train. We currently have 13 training partners, and between CAWST and our training partners, last year alone, trained over 10,000 people from 162 organizations in 103 countries. Those organizations reported reaching 5 million people with better water, sanitation, or hygiene. This is the power of that multiplier or ripple effect of focusing on investing in human capacity to be able to take action. We do this with a global network of clients, and those clients are small little organizations that are local through to large local organizations, international organizations of all sizes, UN agencies, and governments. Collaborators are academic, university, and technology institutions. And then we have a whole suite of donors who've contributed to developing our model and the implementation of it. And they come from corporate, government, and individuals predominantly, but also foundations. And they're investing in CAWST to be able to be entrepreneurial, take risks, and focus where the need is greatest. And I might add here is that this is, while human capacity is one of the biggest gaps for the WASH sector, the convincing people to invest in people is perhaps one of the hardest things that I've done in my role. You're all familiar with Sustainable Development Goals. Our world came together to develop these, identifying them as the most pressing issues that we need to focus on. No matter where each of your focus is and your interests and your studies and where you see your career going, what you're doing is really important, and equally important, and I think conferences like this are a great platform to be able to connect the dots between these different issues. No one organization, cause, individual is going to solve the issues that are facing us today and going forward in the future. We're in this together. And whatever our cause is, understanding the interconnections with the others is critical. How we define the problem impacts how we define the solution. And that is an important thing to take forward into your work, into your studies. as I go forward in this presentation is I'm sharing how we define the problem from a CAWST lens, from an engineering lens, and from the perspective of SDG number 6, clean water and sanitation, and the safely management of that. And arguably, it's an underpinning across achieving all of the SDGs. As I've led the organization of CAWST and our increased reach and impact around the world, one of the things that has been a center point for me in thinking about how we lead the organization and how we solve some of these massive issues is what's needed to be able to make decisions in an increasingly volatile, complex, uncertain, and ambiguous world. And how do we create an organization? How do we create the systems? And how do we support people to be able to act and be resilient and adapt as they go forward in addressing these challenges that lie ahead? And they're only becoming more challenging. The left-hand photo of the little girl who's dealing with a massive flood. And on the other side of the scale, we've got this woman who's climbing down a well in India. And this came from an article just a week or two ago from one of our staff. She's climbing down a well to get the minutest amount of water that's lying in the bottom to be able to support herself, her family, and her communities. How are we going to be able to adapt in this changing and complex decisions that are in front of us? This is scary and it's real. This woman is collecting water to take home to drink, and women in Africa, some of you may already be aware of this, typically women, but will walk on average 8 hours a day to get their water. How do we make that, reduce that time? How do we treat that water so that she, like Gladys, can have a better future for herself and her family? It's unacceptable in 2022, when there's technologies that exist that can change their lives tomorrow, for people to be struggling with this issue. And I'm going to sort of take a sidestep in terms of how simple the solutions can be. Just letting water sit overnight can reduce pathogens by 50%. That this woman could do tomorrow and improve the water. By pouring it through a sari cloth, that it can reduce cholera by 50%. It's that simple to make a tremendous difference. And then with a little bit more capacity and ability and access to technologies, you can make an even better difference. How do we support people to have a dignified life, to be able to go to the bathroom, as you heard from Dr. Susan Elliott yesterday, in a way that's safe? This toilet here, I'm not actually sure if that's included in the safely managed sanitation, because some of what is or isn't included is questionable. So almost half the world's population not having access to safely managed sanitation. And of course, that has a direct implication on the quality of the water. The 2 billion people that do not have safely managed water are largely drinking fecally contaminated water. That's something that we can solve. How do we ensure that these kids have a hand washing station once COVID ends, and that people understand that hand washing is a everyday thing, not only in a pandemic, not only because of this crisis? We're already seeing this from our staff that are going out to visit our clients for the first time in a while, is that push for hand washing needs to continue. And how do these children not only survive but thrive? That the water that they drink enables them to be healthy, to be able to learn, to go to school, to grow up, earn a living, be contributing members of society. I'll draw your attention to that group of people in the back with all the jugs and the barrels. They're coming to this water point to get water for their domestic use, the same water that the pig and the cow are using and that donkey in the back. These are huge challenges in front of us for getting universal access. So this graph is a pretty stark one in showing that in the 1980s was a decade of water, and since then the progress in water and sanitation has been flat. The rate of progress has made flat. As we know, we have absolutely made progress and improved it for many. And so why has the rate of progress remained flat? And you heard yesterday from Dr. Elliott that there was a call for not 1%, but 3%. The most recent call from the UN is that we need to quadruple our efforts. So why has it remained flat? And understanding what has made progress is really important. What we don't know exactly, but what I would venture to say is that it's the increase in population, the increase in contamination, and interestingly, as we get better water to more people, the people who are most marginalized, most vulnerable, are the hardest to reach places, are the most challenging to reach with access to water, and the most costly. And so we believe that is contributing to the fact that we have flatlined in the rate of progress. So how do we accelerate that and create more of an exponential increase in access for all? How do you, in a place that's rural, remote Ethiopia, for example, and to put this village in context of Ethiopia, the scale of the issue is massive. We've got a country of 100 million people, 80% of which don't have access to safely managed water and sanitation. That's 80 million people. How does a government, how does a system support 80 million people get access to water and sanitation, mostly rural and remote communities like this one? Or congested living areas like this in Rio de Janeiro, and any mountainous city in the world that I've been to has sprawling, congested neighborhoods like this one, where it would be an engineering feat to be able to put pipes into this, whether it's to bring water in or to remove sewage. Just a few weeks ago, I was in Venezuela, and there's a neighborhood like this that goes up the side of Caracas, and we visited a school on a Tuesday, and the prior Wednesday was the last time that they had water. Or in disasters like this earthquake in Nepal from a few years ago, and the rural community that was demolished by it. These are not easy solutions. Or here in Afghanistan, they have a pipe stand, and presumably the water coming from it is safe. But what do you do when you bring the water home in those jerry cans? And will that water be safe by the time this family consumes it? And this in itself, just having safe storage, is one of the challenges in front of the WASH sector. It's often the water is safe when it goes in from a pipe like this, but it's not safe by the time it gets home and it's being drunk. So we need other solutions. And they exist, like I mentioned earlier. And this is where CAWST's focus is on understanding the options on the affordable, appropriate technologies that people can implement themselves in their homes, schools, and communities. And equally important is the human capacity so that they're implemented correctly and are able to operate and maintain them for the long term. Like Dorica, she is using that biosand filter, She was trained as a volunteer community health worker, kind of like Gladys, and had been promoting water and sanitation and hygiene for health in her communities. She was so motivated and so convinced of the benefit of having safe water and seeing the change in her family that when she moved kilometers away, several kilometers away, she and 3 other health promoters carried or pushed this BioSan filter in a wheelbarrow to her new home. She reinstalled it herself and continues to have safe water and sanitation. And I've got to say, these filters are heavy. They're not easy to move. They're built of concrete and are filled with sand and gravel. And this is just a demonstration, once again, of a capability of people when they have the knowledge, skills, and capability to take action. Eureka represents one of thousands of millions, billions of people that are at the base of this water drop. This is where the greatest opportunity to affect change is, in investing in them to be able to take care of their own water and sanitation, and for them to train others. This water drop represents the access to information, knowledge, and the number of people. At the base of the water drop is the majority of the people who have access to the greatest information about their community, their culture, their context, their language, whether it rained yesterday, when it's going to rain, whether on one side of the river it has a lot of rain or the other it doesn't. They have the local wisdom. At the top of this water drop is where the fewest number of people have access to the greatest amount of information and knowledge. And I would place myself in between as an engineer, highly educated. All of us that are on this call would fall somewhere in the middle and up. And within each one of these layers, we can communicate relatively easily. We share the same language, are able to talk at a similar technical level, but between them, I should say, there's a gap. There's a gap in the knowledge exchange, and the greatest gap is with the local communities. And this is where CAWST has focused our attention for the last 21 years, is unlocking that flow of information, acting as a translator, distilling down complex concepts to simplify it so that anyone, anywhere can take care of their water and sanitation. And this is what resilience looks like. This family in Haiti is one of many who get bombarded with environmental and human implications, disasters. As some of you may know, Haiti is hit with hurricanes, earthquake, and in our Timonite Valley a few years ago, they also got hit by a new disease, which was cholera. In our Timonite Valley was where the greatest hit of this cholera outbreak was. And within our Timonite Valley was several communities with a pocket of people who didn't get cholera. Why? Because of a little local organization taken training from ours, several training, and had gone on to implement house water treatment technologies and training community health workers to be able to interact with homes. They were able to respond with information before any international organization could, and they responded in areas where no international organization went, to reinforce education messages around cholera, water, and health, and to be able to have households be able to understand how to watch for symptoms and to address it if somebody did get sick. And so in that pocket where this organization resided, there were communities who didn't get cholera. They were able to respond immediately to a change that they'd never seen before. This is an example of resiliency. Now, right now, and as we get to the middle of 2022, some of the things that are exciting me most is how we're going forward to integrate what we've learned in the online space and the digital connection with our human interaction, and integrating it to be able to provide the best service we can, real time, as needed, when needed, to thousands of organizations around the world. In the tail end of 2021, we had thousands of people taking our training online, and we adapted to what we were hearing and seeing. So for example, in Venezuela, there were 150 people who were unable to get full access to our online training on house water treatment. And so our team set up a WhatsApp connection and provide little micro training on topics that people were able to access online and have Q&As going with the WhatsApp. That's what they're using. And now we're spreading that, what we learned there, to other locations. This week, on Tuesday, actually, we had a learning exchange in Latin America where 200 people were registered for it. We know that we can have those introductory trainings and support for people, and then the immediate next question is then how do people get the practical hands-on experience to be able to implement these technologies, operate, maintain them in their communities. And that's where both CAWST and our training partners are so important, to be able to do the practical component of a drinking water quality testing, so that people can know how to not use it, not just theoretical, but practically test their water or implement house water treatment or build a latrine, etc. At the core of who we are and is the philosophy of making water knowledge common knowledge. Water is fundamental to our human and environmental survival, our ecosystems, and the more people who have that basic knowledge to be able to take care of their own water and sanitation, the more that will be set up to be able to address the immediate challenges in front of us of universal access to safe water, and to build a more resilient world. Once again, wherever your interests lie in this theme of water and environment, know that what you're doing and where your focus is important, because they're all leading up for us to be able to serve people like this woman getting some safe water. Us understanding the interconnections enable us to work together, be able to adapt and be agile for what is to come. And at this point, I would like to thank all of you for joining the presentation, and I'm going to stop sharing, pass it back to Kelsey, and I'm really looking forward to the conversation with all of you.